Hi, how are you, Mom?
Good. How are you?
Ariel. How's your baby doing this morning?
Oh, she's doing great.
Good.
She's been hungry though, keeping me up. I'm tired.
Oh yeah, I'm sure you are tired. Well, I'm Steve. I'm the nurse. I'm here to do some discharge instructions with you. So soon you're going to go home with your little baby, get to spend time together.
Yay.
So I just want to cover a lot of things with you. Basically, I'm going to give you this paperwork to take with you in the end, so that if you have any questions, you can refer back to it.
Pretty good.
But just want to kind of go over some things with you, and then I'll, discharge instructions for yourself, and then I'll go over discharge instructions for the baby.
Oh, the baby gets some too.
Yeah,
Okay.
yeah. You'll be the one receiving them though, so
Okay.
you got the big job now. All right, so as you've been taking your prenatal vitamins, you'll want to continue to do that, especially while you're breastfeeding. You plan to do that, right?
Yes.
Okay. You're going to get a prescription for 800 milligram ibuprofen. If you need stronger pain medication, then talk to your doctor, and you can kind of see where you need to go from there. But that hopefully will be sufficient for what you need. You may experience some bleeding, like a light period for the next 6 weeks. It'll go from like dark red to start, to pink, to yellow, to white, and then eventually it'll stop when your cervix closes up. If you pass clots bigger than like a golf ball or an egg, so pretty big ones,
Okay.
or just like a lot of clots, or you saturate an entire pad within an hour with red blood, that can be a sign of a medical emergency. You'll want to, call 911, get the ambulance on the way, get the doctor a call, and head to the emergency room.
Okay.
Worst case, hopefully none of that's going to
Hopefully
happen,
that
but
does
if
not
it
happen.
does, you know what you need to do.
Yeah.
You will want to use good peri-area care. We're going to send you home with a few peri bottles. Are you familiar with what that is?
I am. Yes,
Okay.
they are wonderful.
Yeah, so that'll help you when you're, using the bathroom, just to clean up and stuff like that. So don't want to use any tissues to dry off with. No rubbing or scrubbing, just pat dry
Okay.
with a clean, towel. And then no tampons, sex, douching, basically nothing in your vaginal area, for the next 6 weeks.
I think that area's seen enough action for now.
Yeah. So you're going to want to just consider that when you're doing this, you can do like a sitz bath. You're familiar with that? It's where you fill up a basin with warm water, and that'll kind of help out with your pain from your incision. You can use a peri bottle with soapy water to help cleanse your incision if you like, and then have a look at the incision with like a handheld mirror or something like that. If you see anything going on, like redness, swelling, drainage, unpleasant odor, anything that you wouldn't normally experience, those could be signs of infection, and you'd want to get a hold of your doctor and let them know that. You do need to make sure to wear cotton underwear that goes above the incision line so it won't rub on top of it. Want to make sure that the steri strips are removed within the next couple of weeks, because if you leave on your 6-week appointment, skin will grow over them and it'll be very painful.
Oh, so they'll just kind of come off on their own.
Yeah.
Okay.
Yeah. So you want to wear a supportive bra if breastfeeding, mainly just to keep everything kind of in place, so it's not becoming engorged, which would be like if one of them were to become swollen, hot, painful, something like that. Is something that can happen. When you do that, you'll put like cold packs on it to help bring down the swelling and the pain.
Mm-hmm.
There's a like urban legend or something along those lines that if you use cabbage leaves, it can help by putting them in your bra. Don't do that. It actually dries up your milk supply, and it's not something you really want to do. Other things you can do along with that, before you breastfeed, you can take a warm shower. You can use warm packs. You can express, the nipple. Express some of that milk to help kind of massage it and get everything flowing really well. And you want to feed the baby every like 1 to 3 hours until, you know, basically she unlatches and she's done.
Okay.
You know. Mastitis is something that can happen to your milk ducts. You can get it it can occur from the baby's mouth, basically being on there all the time. It can cause you to feel ill, like flu-like symptoms, like fever, achy joints, red streaks on breasts. It is still safe to breastfeed the baby while you're on antibiotics. So if you end up taking antibiotics for something like that, you can still feed. But make sure to feed on the affected side first. Let's see. A couple of other notes to make. Walking should be your only exercise for now. And I know you like to do half marathons and things, like probably don't want to do that for some time.
It'll be a while.
Until you're well healed. No heavy lifting more than 10 pounds. Stairs are okay, but you know, just be cautious. Listen to your body for the next 6 weeks. You know, give yourself time to heal. You've gone through a lot. You know, take a vacation in a way. You know, like just give your body a little time to rest and, you know, get seated in well with your baby and, you know, used to how all that's going. Speaking of that, you want to try to get sleep whenever the baby's asleep. So, you know, if you put her down and she's asleep, you need to sleep. You know.
So hard. Yeah, I know.
Yeah. Yep. And you know, there are some other things to be aware of. Do you know what postpartum blues are?
Like the baby blues.
Baby blues or postpartum depression. You know, those are normal sort of feelings that you can have, where you might feel sad, you cry a lot, you know, things that normally wouldn't make you upset or feel emotional trigger, and you do. But that's not such a big deal. It's when it, you know, becomes progressively worse, like if you're feeling sad all the time and, you know, you just can't shake it no matter what, you're not feeling, you know, a connection or any of that, you'll want to get in touch with your doctor and definitely, you know, speak with your partner and kind of, you know, keep them in the loop about how you're feeling. So a little bit is normal. A lot of, you know, really feeling down is not normal, and you should have. I mean, it's normal. It can happen, but it shouldn't happen.
Yeah.
Long term. No driving for a week, and so just have your partner drive you wherever you need to go. Signs and symptoms and things you'll need to call your doctor about. So any temperature over 101, you know, any pain in your calves, if they're really warm to the touch or they're really hot, could indicate blood clots, which could be a big deal. So you'll definitely want to call your doctor and let them know if that's something that you're feeling. Another thing to watch out for is worsening abdominal pain paired with a fever or like an infection. You know, it will feel different from cramping. It's just like if you get a fever and you're experiencing a lot of pain and it just gets worse and worse, you need to go and see the doctor and go into the emergency room if possible. Headache that doesn't go away or gets worse after you take medication, like blurry, spotty vision, new or low back pain, signs of high blood pressure, increased risk of stroke will occur during the first 6 weeks if you are having high blood pressure. So, you know, just keep an eye on you, monitor your blood pressure a couple times a day if you have any issues with that. I didn't see any of that in your chart, but something to be aware of. And then you'll want to follow up with your OB in the next 4 to 6 weeks. And if you have any of those, you know, emergency signs, obviously call in. Something to be aware of. Okay, discharging for the baby. So you want to feed the baby on demand every 2 to 3 hours. And a lactation consultant will see you right before you discharge today. Babies typically will cluster feed at about 2 to 3 weeks, and then again at from 3 to 4 months, and then about 6 months where they're just really going through growth spurts, and they need a lot of milk. So you'll notice that it's sort of a normal thing.
Yeah, you were doing that last night, night 2. Woo!
Yeah. You should see from the breast milk about like 3+ bowel movements a day.
Okay.
You should see also the baby's wetting diapers, like 6 per day at a minimum. If you see more, that's okay. You just don't want to see less. Just let you know that she's well hydrated, she's being properly fed, that sort of thing. As far as bathing her, you do want to bathe her every 2 to 3 days. I wouldn't do it every single day. It's just too harsh for her skin. It's new and fresh. You want to use products for sensitive skin. No baby oil or powder that they can inhale. Like baby powder, don't do that because they can actually breathe that in and it can cause a lung infection. You'll want to clean the umbilical cord every day with soapy wet washcloth. No alcohol products at all around that because it'll dry it out.
Oh, okay.
So just clean it about 2 weeks, 10 to 14 days. It'll just turn black and sort of just fall off. So
I don't need
and their belly button will be there and
Okay, so I don't need to
nothing.
clip it or anything.
No, don't mess
Okay.
with it.
Okay.
Just let it fall off, dispose of it when it's done and you'll be good. You do want to make sure that you don't put any lotion on her hands because they eat their hands, put them in their mouth a lot. Because she's a girl, you'll want to wipe her from front to back and make sure to clean between the labia. You will want to consider, are you aware of what SIDS is? Sudden infant death syndrome? Okay, so whenever you put your baby down to sleep, she needs to be on her back. You don't want her on her tummy, on her side, just back to sleep. That's the easiest way to remember it. You don't want to have pillows, stuffed animals, blankets, really just, the bassinet or the crib and the baby, nothing else. You want to dress the baby, as warm as you are dressed, because you don't want the baby to get too hot or too cold. So, if you're wearing a jacket, she needs to wear a jacket and like that, Let's see here. All right, so other than that, all right, so it's best to keep your house cooler, around 68 to 72 degrees. That'll help with regulating her breathing.
Oh.
Tummy time is good for like playtime. You can put her down on a blanket and
Those neck muscles.
let her strengthen those neck muscles. Yeah.
Strong girl.
Having a baby can be very difficult. In terms of you're adapting to it, your frustration is high. You can have problems with the baby's just crying constantly and you can't soothe her. If that occurs, the best thing you can do is just set the baby down and in her crib or bassinet and leave the room, take a break, take some breaths, calm down. She'll be fine. You can kind of mentally center yourself again. And then you can go back to it when you're ready. But the thing is that, you don't want to shake the baby or do anything that might harm the baby. And so when you feel your level of frustration peaking out, you need to just set the baby down, hand it off to your partner, and then, take a break. It's just something everybody needs. It doesn't mean anything about anything. It's just everybody needs a break sometimes. And so, anyway, do you have a car seat?
I do.
Okay. Is it infant carrier?
Yes.
Okay. And do you know how it's supposed to be positioned in your car?
Rear facing.
Rear facing, right.
Yeah.
For the first 2 years, or until your pediatrician says it's okay to turn it around, you want to face the rear.
Okay.
It's just rear and center is sort of the safest place that a baby can be. You know, if you were to get in a car accident, God forbid, that's where you need her to be. And facing the rear is going to keep her in the best possible place until she gets control of her neck. All right. So other than that, you don't want to bring her around any big crowds. I mean, ultimately, it's your decision, but for the first 10 days, you know, it's probably a good idea to definitely keep her away from people. And then up to 6 weeks, it's best to just stay away from crowds because her immune system is immature and she's susceptible to viruses and bacteria and things a lot more than she will be later on.
Right now.
Yeah, just kind of slowly introduce. So something that you'll want to do if you're ever going to take her temperature, which you will obviously, you'll just do it axillary, so underneath her underarm. And then you can also do it rectally. You'll just want to make sure if you do that you get a rectal thermometer and you don't insert it too far in there. So axillary under the armpit is going to be like the easiest thing to do. If she were to have a temp higher than 100 degrees, you want to call the doctor. All of these are going to be things that you'll want to, you know, touch base with the doctor on, like coughing, congestion, difficulty breathing. If she turns blue-purple, call 911. You can tap the bottom of her feet, and sometimes that'll help her to catch her breath. But you know, if that's something that's occurring, just call 911. If she has any raised hives or welts, an allergic reaction, it can be something that you've eaten that has passed through the breast milk and it's causing her to have an allergic reaction, so you want to keep an eye out for that. If she has any vomiting or diarrhea that leads to her being super sleepy, or you're not getting wet diapers for 8 hours, no poop, no tears, sunken fontanelles, then you know that means that she's getting dehydrated, which means she's not getting enough fluid. You know, if she's feeding well, she'll stay hydrated pretty well, but you know, obviously intake has to exceed output, otherwise you can end up with dehydration. All right, so short of that, you know, if the baby's just crying consistently, they can go through periods of time when they call it purple crying, where they're just basically inconsolable. Usually happens like mid-evening, like 6-7 o'clock in the evening. Some people call it the witching hour. But basically, you know, like just the baby is inconsolable. It's not that they're hungry, it's not that they're wet, just no matter what you do.
Just cranky.
So those are good times for laying the baby down and taking a little mommy time to step away, because nothing you're gonna do is gonna solve the problem. And it's really, that baby cry is gonna set you off, because that's what it's supposed to do. So if you do see any discharge or odor coming from around her eyes, her ears, her umbilical cord, anything like that, you'll want to report that to your doctor. Something else to be aware of, at about 3 days of age, jaundice peaks, which is like a buildup of bilirubin in her system. And so she'll poop that out, but her skin might start to yellow. So you want to open the blinds, get indirect sunlight, which will help her to break that up. But if her eyes start to turn yellow, the yellow in the white part, then you'll want to you know, call the doctor and follow up, because that could be a medical emergency. You'll want to follow up with her pediatrician in 24 to 48 hours. Have you got an appointment set with them yet?
Yeah, they came by earlier.
Visit? Okay,
Yeah,
good.
yeah.
Yeah, that would definitely be helpful. Short of that, that was a lot.
You're gonna give me all those papers, right?
Yes, I'm gonna
Okay,
give you
thank
all
you.
these papers. All right, so other than that, that's it really. That's a lot of information. Do you have any questions?
Did you catch all that?
She soaked it all up.
She
Her
soaked
brain
it.
is
She's-
perfect.
she's
It's
so
like just
smart.
firing on all cylinders right now.
Yeah, no, I think I understand it all now. Whether I remember it, you know, but if I have
Right.
notes,
You have
then
these, so I'm going to go ahead and give you
Okay.
those.
Thank you.
And you know, we're here as your support system. Like if you have any trouble, definitely call in and speak with your doctor. If it's something concerning the baby specifically, then your pediatrician is a good resource, and you know, help is only a phone call away. So if you have any trouble,
Okay.
let us know.
All right. Well, thank you so much.
Thanks
I appreciate
so much.
it.
Yes, ma'am.
Bye.